Welcome to On the Couch with NMC. I'm your host, Anthea Neumbo. Today we're going to talk about mental health and mental illness in Namibia. To help me do that, we have our specialists in the field, Dr. Joab and Mrs. Edwina. Welcome. So tell me, is there a difference between mental health and mental illness? And if there is, what is it?
You know, the interesting thing is mental health and mental illness. I would just put it like the opposite, right? I can say mental health is the absence of mental illness. Mm-hmm. Or I can say mental health is a state of psychological, emotional, and behavioral well-being. So you talk of mental health, we are talking about somebody who is not having some mental disorder or psychological disorder. Whereas if you look at disorders, we are looking at functionality, whereby you are not able to function very well psychologically, behaviorally, whereby you are having a diagnostic illness. Mm-hmm. So it is more like that.
Mental health is for me living optimally to your fullest potential with excellent quality of life and aspiring to that. Mental illness, on the other hand, is sitting with chronic mental, psychological, emotional illness, disorders that impairs and affect your life and your overall well-being negatively.
So in Namibia, do you think we have a good understanding of mental health or mental illness? What would you say in your opinion?
We have a readily better understanding 2022 of mental health because of initiatives like this that we psychoeducate ourselves and our people. We are developing and progressing with our knowledge, yet there is still a vacuum, a lack, because of the way we speak, our storytelling, the topics of our discussion. It's not such a priority as we would like to see as mental health workers. Also in the rural areas, we try with national initiatives to bring the information to every corner of Namibia, yet it is still challenging. And it depends on the media coverage of what seems to be a priority and what sells, as we say in the tabloids.
I see. Anything from your opinion?
Yeah. I would say Edwina is right in the sense that we are seeing a movement of sensitization of mental health. And I think this started when we had this pandemic and before. But traditionally, mental health has been at the backseat. I have worked at the psychiatric hospital. They receive the least attention. They receive the budgets, which are quite minimal. And if you look at the rural areas, depending on the literacy levels, the attribution in terms of causality of mental illnesses is spread beyond the medical fraternity. They would attribute it to witchcraft, to demons and all that. So it affects the health-seeking behaviors. So the awareness of mental health, mental illness, to me has been, pegged on the correlation with literacy levels. Yes. The better people are educated, the better they are understanding, and also these initiatives that are coming up. But you see, when you look at literacy, when you look at incomes, these platforms, people are not having access to all of them, especially in the rural areas. So still, there is a segment of the population which lags behind.
So basically, we need to find out how we can close that vacuum so that everyone can get the access to it.
Precisely. If you look at this initiative, it is an initiative from the medical aid group, meaning for people who are employed, who are working. What about those who are not? So there is that population, but still we are assuming that this platform will filter downwards to the uncles, to whoever is out there.
Okay, coming back, you just basically mentioned COVID. So how has COVID affected mental health, mental illness in Namibia? What do you think have we seen an increase or is there a decline?
I want to say certainly there has been an increase. In fact, for me, this was the first time when I realized that mental health is a big issue. Why? The problem was the pandemic was unknown. No one seemed to know what to do with it. People were looking up to the government and saying, what is going to happen? People were looking up to the professionals. Are they going to find a solution? The children were closed in the doors. People carried the guns in the street to try to control the movement. So there was quite a lot of scare, uncertainty, and that's a good breeding ground for anxiety. Uncertainty, if you corner the children, their lives, they changed. Work, closed, movements closed. Naturally, we are social beings. We survive through interaction. And that was removed. When you are sick, you are in hospital. You become better when you are visited by family. The family was cut off. Don't visit him. People died on their deathbeds without saying goodbye to family members. Just imagine the scare. So we saw an increase from the sufferer to the affected, to the healthcare workers because of uncertainty. Therefore, the rise in the cases which I saw were, number one, anxiety became quite elevated. Trauma, especially those people who were put on ventilators, it was quite severe. And of course, depression is a cousin of anxiety. It just, increased. So there was quite a lot of elevated, stress levels right across the board because of the uncertainties of COVID.
Yeah. Ms. Edwina, you have your own practice. So how did you see this influx that COVID caused in your profession?
Obviously, a lot of clients came with mood disorders, which rise by 25%. The leading one, like Dr. Joab, my colleague said, was anxiety, led by depression, led by post-traumatic stress disorder, because of the multitude of deaths of our significant others, and also the stress. When stress rises, our emotional, cognitive resources are taxed tremendously, and we are drained, and that causes the unstable mood, and also the psychosocial stressors of the economy, the time for recovery, the bereavement, the trauma of not having the customary burials of our loved ones. Like Dr. said, saying goodbye in hospital, it was felt, tragic, and the doctrine was in Namibia that it is inhumane. So also the scare of losing your job, losing your means of income, making a living, bread on the table, and whether you can return to work when you yourself are sick, or losing our breadwinners. We saw that a lot in Namibia.
So basically, just wrapping up, we see that mental health just doesn't happen overnight. It is a process, as I can hear from what you have been saying, how it is. Tell me, the build-up of mental illness, is there any kind of sign, or what should we look out for? Because I've heard from you guys saying COVID has caused that increase, but what were the signs that we were missing already, even before COVID was there? What were the signs that we were missing that has led up to all of this rise?
I would say the telltales are, like I said, the mood, your sleep patterns are being disturbed, your eating patterns are disturbed, you have a lower or a higher appetite, and weight gain or loss, 5% of your body weight. Then also you have less energy, or you are restless and you are more agitated, or you are hypervigilant. So these are the telltales that we investigate on a daily basis. Even your libido, you lose your vitality, your zest of life. So these are the telltales. Also your appearance and your grooming, whether you get out of bed, do you get through your daily routine and activities and obligations? We call this functioning. So if you look at the human being's functioning, the way you walk, the way you talk, tone of voice, the eyes, the windows to the soul never lies. So these demeanors, the effect of the face and your facial expressions, it gives a lot of telltales. People think we can't see mental health, but we definitely can see it in behavior.
I just want to really say, Edwina said it very well, and just to sum it up, at community, at family level, to detect mental illness, change. The moment you see a pattern of change, somebody has been behaving like this, and suddenly you see some changes. You have been visiting the hair salon, you no more go there, you cut the hair. You have been a socializing person, you are now mostly confined in your home. So when you notice changes, you start to know that there is a problem. People who commit suicide, afterwards you hear, he had just suddenly changed. He used to come to church, he used to be with others, he was mostly at home. Change.
Wow, that is a lot to digest. So we'll just take a few minutes and then we'll be right back. To continue, so Dr. Joab, what are the most common mental health issues or illnesses in Namibia and why?
I think we have actually somehow referred to some of them. Depression that we have mentioned with my colleague Edwina, anxiety, trauma-related syndromes. The reasons are quite varied. Number one, we have like what are called prevalence rates, which is more, international, like percentages, 3 to 5% being depression and anxiety thereof. But of course, we look at it in terms of causality. What are the drivers? What are the triggers to these conditions? We are looking at stress being one of the main, drivers to these conditions. The changes that we're talking about, COVID, the economy, problems in the families. I'm part of an organization called Global Psychology Alliance, where we noticed during this COVID period, the rise in gender-based violence, actually, because of confinement, people staying together in the same space, they irritate each other, and there was a rise in that. So we see quite a lot of those cases, and basically it's because of the changes, in the environment. Yes.
So would you say, because of this rise in the depression and the whole anxiety, do you think this has led to more suicides in Namibia?
We already had a significant high suicide rate in Namibia before the pandemic. It was also allocated by Namibian research and data that it is more rife in certain regions of the country. Yet with the accentuation of such a high stressor, a life crisis such as the pandemic, obviously because our mood was more destabilized and irregular, our behavior was more erratic, and therefore obviously the suicide rate increased if there is a higher rate of anxiety, depression, trauma, PTSD, and the most important one that we neglect is substance use disorders. We find it common that alcohol is a common social drug, and we would say alcohol and substance use disorders, or alcohol and drugs. Alcohol is the drug on earth in Namibia that still does the most harm to our general and our mental health. Because of that, some people, to build up the guts, they would first drink pills or they would drink alcohol and then they will commit suicide. Not always, but it's also a contributing factor. So we also do not notice the grave impact because it's silent killers, the drugs. Silent, very subtle killers of our people, not only by motor vehicle accidents or suicides, but fighting, crime, and so forth, like Dr. Joab referenced to.
I also wanted to add that we also saw an increase of suicides and suicide attempts to the younger generations, young populations of late. I think there is a need to carry out researches, but of course, anecdotally, I would say that the changes that has been coming around the pandemic, as I mentioned, the confinements, the changes, coping with school online, they were being taught face to face. Now they have to do the assignments. They don't have somebody to support them. So they were quite frustrated and stressed during that time. Job losses. The parents used to be, top-notch, employees. All of a sudden, Namibia is closed. The pilots, top of the cream, they don't have jobs. Where were their children in the best schools? Now they go down to the government schools. Those changes, children struggle to cope with them. So we really saw an increase, even in depression, within, children.
So basically you are telling me we need to do more research in how we can help the youth actually in that aspect because of the whole changes that has happened. Because most of the things I can now see, it's mostly targeted on the older generation or the more prevalent, and then not really the youth as it was.
Precisely because the assumption is that children don't have problems. The assumption is that what are you thinking and worried about? I'm the one who's bringing the food to the table. I'm the one who's looking for the school fees. So they are supposed to be, problem-free, but that's not it. They are receivers of our problems. They process the same things. They live in the same world. So we need to understand mental illness and mental health within the context of their age, within the context of their environment, their needs, their drivers.
So tell me, Alzheimer's and dementia seems to become more relevant or more common now in Namibia. So what are the symptoms of this illness? What is it? What is actually what is Alzheimer's? What is dementia? We hear it a lot. Everybody just think, yeah, you forgot things, you're becoming crazy.
Alzheimer's it's a neurocognitive disorder whereby the common symptoms are impairment of cognitive functions such as memory. Usually you find a decay of memory, short-term memory, whereby they tend to forget recent things. It's like building a block. You put a brick, the other one falls, you put another one, because they are not registering new information. There are different types of dementias. Talk of Alzheimer's disease, vascular disease. There are others called Huntington chorea, but usually they've been common among the elderly. If it is below the age of 60, they say pre-senile, then it's senile after the age of 60. So there are other causes like the use of excessive drugs, alcohol. The brain is affected, atrophy and all that. You find some people who use too much alcohol, they start to develop memory problems because of the brain is affected. So it's more of, I think, the downward trend that we see from the age groups.
So Ms. Edwina, how are this treated? How are Alzheimer's and dementia treated or managed? What would you say? What are the treatments people can seek? What are the things we can also do as maybe the family members of this person that is suffering from Alzheimer's or dementia?
It's all about functioning. So number one, medication, especially with such a severe brain disorder such as dementia. You lose skills. So it's also about training and supporting life skills. A friend of dementia is once again mood disorder. It's actually very difficult to distinguish between Alzheimer's, dementia, and depression, because your psychomotor functioning also declines. You will leave the stove burning. You are unable to register, I need to get dressed. You don't know where you are. You can't work. So institutionalization is often an option, or at least if it's rife for a period, the episode, the person is stabilized in terms of institution, and then aftercare at home. So it is very taxing on the nurturers, the caregivers, like we saw with frontline workers. And such a person, it depends on the degree of the progression of this brain disease and your functionality. The family needs to support a lot, like nurturing a child. That's why we see on movies and in media that you return to a childlike state, because your executive functionings in your mental capacity, like planning, like organizing, like grooming, like discipline, in all sorts, goes down the drain with your brain degenerating.
So besides Alzheimer's and dementia being institutionalized, what other mental health issues or illnesses can still be institutionalized?
Schizophrenia, bipolar mood disorder, any form of mental health disorder where psychosis, neurosis, psychosis is when you are out of touch of yourself and your realities. Neuroticism is erratic behavior that we cannot allow or contain. That's why people with antisocial personality disorder also end up in corrections, in prisons, to contain their behavior and the symptoms of these grave mental health disorders.
So does it depend on the severity of your illness to be institutionalized?
Definitely, It must be justified. You can't just institutionalize people. It's also very expensive, and it calls for a lot of resources from professionals, from living, frail care, nurturing, nursing, and all of that.
Yeah, I also wanted to add that depression, you see people being admitted, especially if they are suicidal, for suicide watch, dangerousness to self.
Mm-hmm. Yeah. So how does mental health affect the family? This is now the family of the person affected. How have you seen, because I'm sure family members also come to you guys and try to figure out how they can cope with this situation. So how does this affect the family?
It is a decay of interpersonal relations, because there's confusion, the person acts out of character, the person's mood is not stable, the person is seen as still Edwina, but it is the disorder now at play. So that mixture confuses people, and because we have to be frank, in Namibia, we really don't grasp and understand mental health, and we feel it's a phase, or you just have to get over it, or you are being unnecessary, or it is not a real disease like pregnancy. How many people do we lose to pregnancy? But it's not considered a disease or an illness, but it is life-threatening. So we don't take the matter serious enough unless it becomes a crisis. Now it drains us and depletes us, and we are now in crisis mode, and we become hopeless, we become anxious, we become depressed, and we become frustrated, and we become irritable with one another. So as family members, we also need to take care of ourselves, to care for others. And we as service providers, healthcare workers, as we've seen with COVID, nurses and frontline workers, we tend to neglect ourselves. And if you are depleted, you don't have the patience, the compassion, the empathy and understanding to take care of your loved one suffering from especially a severe mental health disorder. And we need to do our homework. We need to read. We need to Google. You don't need to be an expert always to know the content, the gist of the matter of mental illness to help yourself.
I think, as I mentioned last time, that mental illness, the key word is change. So as a family, a person suddenly changes. Accommodation. How do you accommodate the changes? If you look at dependency, if a child is, for example, intellectually impaired, requiring more than 50% care, how do you do other activities? It becomes quite difficult. Some other forms of mental illnesses, as Edwina has said, psychosis, they are out of touch with reality. They don't know the effects of their behavior. How do you cope with that? Some other psychological and mental disorders, such as personality disorders, they have no insight that they are not well. They are more disturbing than they are disturbed themselves. The chances of change are slim. Who is affected is the family. The hospital, you go there, you see them for 1 hour. They go back to the family, you stay with them. So the family is the bedrock. They are the ones who absorb all the changes. And hence, one person who is mentally sick affects a lot of people in the family dynamics. And hence, stress becomes quite prevalent. That's why some families sometimes, they even bring back patients discharged at the psychiatric hospital. This one is not well. And yet, if you do an assessment, the person is still functioning very well. In other words,
it's the family
intolerance.
that doesn't get it.
Yes.
Yeah. Well, that was a lot to digest. We'll be right back. And we're back. So, Miss Edwina, I know the youth is at your heart. This is your passion. This is what makes you come alive, so to speak. So, do you think the youth are more affected by mental health now, or more vulnerable now, more than ever?
Definitely, like Dr. Joab mentioned, the youth is more vulnerable. Obviously, with every generation, there's some psychological challenges. Yet we had the pandemic, we can't say it enough, in many years. And also the youth has a lot of pressure. The older generation puts a lot of pressure on the youth because we view things going south in terms of war, famine, lack of resources, and so forth. So we are pressurizing our youngsters, and our youngsters look up to the soft life, so-called. And things don't come so easy, like just showing up and being a rock star, especially in Namibia. So our youth is also a bit out of touch with reality. They need to come down a bit from cloud 9 and face the reality. So that discrepancy makes it very, very difficult for the youth. Our youth is also more, I would say, status conscious. In my time, still today, I don't wear brand clothing and $1 million locks and so forth, and makeup and jewelry and all those status conscious pressures, like Dr. Joab mentioned, the school that you attend, the woos of Namibia, and also there's a lot of bullying, more than ever rife amongst the youth, in terms of discrimination of class, ethnicity, language. How do you speak English? How do you express yourself? Measuring up to being human enough. The last aspect I want to mention is social media and that addiction and the FOMO that You need to be with the hottest trends. You need to be at the most bougie places. You need to be relevant. You need to be current. You need to, the old age that we struggled also, as Dr. said, being social mammals, being in the in clique and being popular. Now more than ever, we watch your every move in front of the cameras. So I think that's a lot of pressure on the youth. And more people are qualified and developed also. So the market is also becoming more and more competitive for our young ones. How many graduates are still out on the street being unemployed, for example?
So, Dr. Joab, what are the negative connotations of mental illness? What makes it difficult for people to even come up and say, I have an issue? What would you think, in your opinion?
The single word is stigma. Stigma. We tend to stigmatize mental illness. It has been stigmatized from different angles. If you look at it traditionally or culturally, you find somebody is said to be bewitched. In other words, there's something wrong with you, something wrong with your clan, your generation. If you go to church, they would say somebody is possessed by demons, you're not praying harder. If you go to the mainline family, they would say, why are you depressed? It's a sign of being weak. Just be strong. That's what they say, be strong. How can I be strong when I'm not well? So the key word is stigma. Even within the medical fraternity, when I was working at psychiatry, I protested about the use of the word a non-psychiatric patient. It's written in the card, a non-psychiatric patient. Now, when they go to the hospital complaining about a headache, the card is showing a non-psychiatric patient. Then they will not treat the headache. They will say it's because of the mental illness. So they are not supposed to suffer from other conditions. They may not explain themselves in terms of even being hungry. They will say probably it's just being manic. So they are stigmatized from different angles. And hence, they would say, why go there? Why come out? Because no one seems to accept that. We as clinical psychologists, you find, if you say, I think your condition now requires the input of a psychiatrist, they will say, no, I would rather not go there. A psychiatrist? I'm not mad, not knowing that they are treating psychological conditions. So there's quite a lot of negative labeling and lack of acceptance, which comes a long way. And that's why people don't seek help until they become out of control. They become psychotic, violent. They end up calling the city police. Then they are dragged into hospital. Or they end up threatening to lose their jobs because they are not attending to their work. They are that just lethargic at home. And then the employer is writing the final warning. Then they are pushed to come for treatment.
So you're saying stigma. So basically one of the main reasons people don't want to come out is stigma. But do you think there is a progression in Namibia with the whole thing of destigmatization towards mental health? Do you think we have?
I've, to be honest with you, I've seen that of late. The youth, the insight. I've seen the youth coming to my practice, sitting there and saying, I've just come to check myself. I've seen a lot of self-diagnosis where they say, I think I'm depressed. Some even say, I think I'm bipolar. Can you please check me? And I'm surprised how they are coming up. You see, as the media has got a role to play, there's quite a lot of influence the media has. It has got negative effect, but also positive. Because the moment it is, trending on things that has got to do with the awareness of mental illness, they join in and they become okay. I've got a young client who has formed a small, support group where they talk about mental illness, and they refer quite a lot of their friends. Go talk, go say it.
Ms. Edwina, have you seen this destigmatization of mental health in Namibia in your practice? Because I know you do it on a daily basis also as Dr. Joab. Have you seen that? Have you think Namibia is now normalizing the fact that you have a mental issue?
We are well on our way. Let me say that. Definitely there's more awareness. People access the services more. When I started out in 2008, I had one client per week. So there's a remarkable difference. I'm sure my colleague can affirm that.
Sure.
And people, they still do shy away. We generally still access the services in terms of crisis intervention, yet there are people who are more open-minded and who really take their general health, well-being, mental health very serious, and we are proud of that, and it gives us hope, yes, to create more awareness and to spread the word of the importance of mental health.
Do you think we as Namibians are doing enough to combat mental illness or mental health? Do you think there's still extra we need to do?
There's a lot more to do. We know it in this room. There's so much more, because the solutions does not equate the level and the enormity of the problems we sit with. And physical appearances, physical health is still prioritized above mental health. And we underestimate the power of the mind and the impact of stress. I always say stress kills, because it leads to especially physical illnesses like heart disease, cardiovascular problems, diabetes, and rheumatoid arthritis, colon cancers, and so forth. We need more centers. We only have 2 psychiatric institutions in the whole country. The dominant bulk of mental health workers, especially psychologists, are in Windhoek. If you go up north, I can't refer to a colleague. If you go south of Marienthal, they are visiting psychologists in Oranjemund or here and there in Keetmanshoop, but we stop at Rehoboth and we stop maybe in Chumep, those areas. The services are not out there. Also, we also need more respect for the service and catering for mental health. When our resources are cut economically in terms of health insurance coverage, the first services that are toned down and limited is the auxiliary services, which includes mental health services. Policy, reform, and guidelines, it's not up to speed in terms of the current issues that needs to be addressed 2022 in terms of mental health.
Coming in conclusion to our riveting discussion, so how do you think that we can encourage Namibians to be more open to it? What are the venues that we can really tackle as Namibians to be like, go and get yourself checked. Go and do this. It's not a wrong thing or seen bad to be part of a mental health community or something.
Let me conclude by giving this statistic. According to the World Health Organization, we spent $1 trillion per year treating depression and anxiety. 1 trillion. Now, if you invest, the employers invest $1 for the treatment of mental illnesses, you'll get the equivalent of $4 in improved health care and productivity. In other words, we have got a lot of burden of care because of mental illness. But if you just invest 1, you get 4 in terms of benefits. So what you're doing right now is a very good initiative, the awareness thereof. Companies investing in mental health. Now, in terms of scaling up the services, the awareness thereof, I think it has to start from all platforms, the organizations, the family levels, the schools, talking about it in their curriculum, in whichever. I think we've got life skills, programs. Universities having clinics for mental health, because students are quite vulnerable because of the stresses of academia. Acceptance, that mental illness is just a health-related condition, just like any other thing. Then we are likely to start moving better and knowing very well that there's nothing wrong to be mentally ill. You can still get some treatment and management. So go and have yourself checked out. And lastly, I would like to say, the one who goes to seek treatment is actually healthier than the one who says, I'm okay. So go do that, because then you will be healthier than what you think.
Miss Edwina, final thoughts?
Exercise your mind like you exercise your body. Service your mind, your heart, like you exercise the rest of your body. Prioritize your heart. Don't sit with heartache and heartbleed, yet you run for physical care with a broken leg or even a bleeding nose. And let us be aware of the impact of our mental health challenges in ourselves and around us. A healthier mind hosts a healthier body, a healthier society and nation.
That was all for us on The Couch with NMC. Thank you very much for joining us. I hope everyone will go and self-reflect on mental health and mental illness. It is not a negative connotation. Please go and get checked out. Let's be the driving force in bringing mental health as a normal issue in Namibia. That's all we have time for today. Until next time, ciao.